build apps in days and weeks rather than months and years. Anyone with a great idea doesn't need any technical experience or any technical skills to be able to build a technology.
Welcome to The Conversation. On today's episode of Trailblazers, Johnny is speaking to Lloyd Humphreys, Managing Director of Cogniss, an organisation that creates advanced patient-facing digital health apps. We hope you enjoyed the episode. Be sure to subscribe and follow us on social.
Lloyd, thank you so much for being here. Absolute pleasure. How are you doing?
I'm very well and delighted to be here. Thank you very much for inviting me.
So for those that may not know, would you mind providing a little bit of an introduction to yourself and your journey into where you are now?
Right, so I'm Lloyd Humphreys. I'm the Managing Director at Cogniss, and by background I'm actually a clinical psychologist. So I started my career way back when, in the late 90s, when I came down to Manchester. Started my career doing research into the effectiveness of different types of clinical interventions. So the effectiveness of cognitive behavioural therapy, or CBT, in schizophrenia, and separately into post-traumatic stress disorder. It's quite strange because now we kind of take those types of therapy for granted, but back then we had to do the research into how effective they were. So after that, I specialised in post-traumatic stress as a psychologist, and then graduated and then set up one of the country's first refugees and asylum seeker services up in Manchester. And that was really incredibly rewarding work, working with people who had fled war-torn countries, persecution, torture, etc. And as I said, it was an incredibly rewarding part of my time, but also incredibly frustrating because people were waiting over 2 years to see me. We had very long, extensive waiting lists, and people were often being deported back to the countries that had perpetrated those things against them. So me and another psychologist decided that we would leave the National Health Service, and we set up our own practice. And this was a practice that we wanted to really help as many people as we could, and particularly those that couldn't get access to statutory services on the NHS. And so we were working with a lot of residential children's homes, a lot of third-party providers, delivering kind of therapy when they might have been excluded from local services. And that was really wonderful. We had kind of 6 regional offices, lots of psychologists kind of working with us. And that was, again, a great time in terms of being able to kind of help a large number of people. We were delivering tens of thousands of hours of therapy, thousands of hours of training. And then we kind of realised that the number of people we could help was going to be correlated to the number of people we could hire. And so we kind of thought there had to be a better way. And this was a time when we were delivering training in the sort of the mid-2000s. We thought, well, why don't we put this training online and we can deliver that online training? And then we got around a table and we thought, well, if we're delivering it online training, why don't we cut out the middleman and actually go direct to the person? And so this is where we created one of the first online treatment programs for addictions called Breaking Free Online. This was the first digital therapeutic. This was before digital health was a word, before digital therapeutics was actually a phrase that we now commonly use all around the world. And that was a really exciting time to develop technology. We had to wait for a lot of the technology to catch up with us. This was around the time of the first iPhone. And so we then created an app around that, and we had to wait until the third version of the iPhone to do some of the things that we wanted that technology to do. So, for example, we wanted the phone to alert you if you went near a risky place. So if you went near a bar, a bookies, your ex-partner's house, we wanted the phone to alert you. But the iPhone couldn't do that because maps had to run in the background. And at that time, the iPhone only allowed maps to run in the foreground. So we had to wait until the third iteration of the iPhone in order to be able to kind of create that technology. So we took that to scale. It became one of the default approaches to online treatment for addictions across the UK and other countries. A really exciting time. I then exited that business. And then after about a decade of making way too many mistakes to mention, I decided to help others make not quite so many mistakes as I did. And so for the last sort of decade, I've been helping other companies, really first of type, really disruptive technologies, to really scale their enterprises and reach as many people as they possibly can. So the first organisation I helped was a company called Patients Know Best, under the amazing CEO of Mohammed Al-Ubaidli, which is a patient portal. I think it's got about 3.5 million registered users. Wow. It's used right across the UK, but also across, I believe, about 13 different countries. So I came in, worked with Mohammed and the team to help scale that up. And that was a really nice journey. It kind of gave us lots of exposure in the NHS in terms of technology really at the forefront in the early days of that innovation. And we were involved in lots of different innovation threads, from the National Innovation NHS Innovation Accelerator Programme, where I was one of the first fellows. We were in kind of the testbed programmes and other innovative programmes. During that time, I then also was lucky enough to do my MBA in Berlin, which was a very happy time, about 18 months doing my MBA in Germany, whilst I was working at Patients Know Best. And then I was kind of drawn and pulled back to mental health. So I was approached to come in as the head of Europe for Silver Cloud Health. And this was one of the first kind of digital mental health products for anxiety and depression. And I was brought in just after Series A to look after Europe and the rest of the world, whilst the founder went over to the US and kind of expanded on the US footprint. So that was a really nice journey. We took that on a 2.5-year journey. From just after Series A through Series B, and then we took it through into acquisition by Amwell in quite a large, kind of significant deal, right at the top of the digital therapeutics kind of boom, really. During that acquisition, I was then approached to kind of come into ORCA, which is the Organisation for the Review of Care and Health Apps, which is an assessment and accreditation organisation to look really to help identify those safe and effective technologies for people to use. I was there for just over about 15 months, and then it was during that time that Leon and Joe, the Chief Commercial Officer and the CEO of Cogniss, they actually came and pitched to me. They kind of pitched to me the idea of a no-code platform for digital health. And my jaw kind of hit the ground in terms of, having been one of those technologists that have created technology, having helped others to kind of scale. It really kind of struck me that this was a paradigm shift in terms of how we can really democratize digital health, how we can really help the healthcare experts create the next generation of technologies, rather than tech companies that perhaps don't have the lived experience of frontline care workers. How can we redress the balance and actually empower the NHS and other organisations and those subject matter experts to kind of create a sustainable digital health ecosystem? So I kind of jumped in with both feet, and it's been a wonderful kind of year in terms of scaling that up, both in the UK, Australia and elsewhere. So that brings us up. So a bit of a long-winded answer,
wow.
But so that's me.
I mean, that's incredible. I mean, you've had an incredible journey, and my question from there was obviously the journey that you've been on and the experience that you've had and all of the things that you've done. You probably would have had quite a few doors open to you before you jumped in with Cogniss, and before getting that pitch. Why was it? I think you've sort of touched on it already with the scalability aspect of it. Why was it particularly that impressed you about Cogniss, and what was the possibility or the opportunity space that you saw with that over maybe some of the other options that you had that encouraged you to take that path?
Yeah. Well, I think the thing that's really driven me is the ability to impact as many lives as possible. So as a clinical psychologist, you get to impact just one-on-one in an individual therapy session, and perhaps multiple people in a group therapy session. And that was incredibly rewarding. But then when we founded my own company, then we could help even more people. We could kind of scale that influence, that impact out. And so for me, really what strikes me and what drives those decisions are the number of lives that I can directly or indirectly impact. And for me, that's kind of been the decision. So something like Patients Know Best, being able to impact millions of lives right across the world, and Silver Cloud Health, which is again has impacted millions of lives. That's kind of really rewarding to be a part of that journey and to kind of help reach people and get the effective care that they need at any particular time. And so for Cogniss, it was really about this being a disruptive first of type that could actually have that multiplier effect, that could really help those innovators, those clinicians, those healthcare organizations to create technologies that are going to have a direct impact on those lives that they directly impact as well. And that scalability was second to none. So that is kind of where what drove that decision to help people create either micro apps that might help 10, 50, 20 people, but equally those blockbusters that could affect 500, 1 million, 2 million, many, many more millions, etc. So that's kind of what drove that decision. alongside the technology itself, the ability for no code, and I'm happy to kind of talk about that no code as a platform, the ability for no code to really empower that, and the maturity and the kind of the excellence in terms of kind of the infrastructure underneath it. Yeah, those are some of the reasons.
Yeah, I'd love to dive in a little bit on no code, but one of the things I wanted to touch on, just to frame the size and scale of the problem that you're solving with Cogniss. I heard you speak obviously at the Digital Health World Congress, and you highlighted a statistic that kind of blew my mind, which was that on average it costs £340,000 to get an app into the App Store, from idea into the App Store. And that often, obviously, healthcare workers, frontline workers, the target that you're seeking to help create these pieces that would actually be able to solve problems at scale, are not the people that are creating those solutions. Why is that cost, just to put a frame around it, why is that cost so high? And what's the downstream consequence of such a prohibitive cost for patients, basically?
Yeah, well, it's not just the cost, it's the time as well. So, yeah, it's about 334,000, I think the latest study is. And that's risen tenfold over the last 10 years. And it's continuing to increase. And that's because we've got so many more technologies to integrate with. Devices, we've got, if you build an app, then you've got to make sure it's iOS, Android, and web compatible. So, feasibly you have 3 different tech stacks to be able to manage straight off the bat. Then you've got to kind of look at all of the sensors and the data and all of that. And so it's incredibly difficult to kind of create these technologies. And beyond that, underneath all of that coding, then you've got to think about all of the hosting. So where is that data living? What is the security arrangements to kind of handle really sensitive patient data? How are you anonymizing it? How are you making sure it gets to the right people, not shared, inadvertently with anyone else? So all of that infrastructure is incredibly important. And then there's always the compliance and regulation behind that. So things like Cyber Essentials, Cyber Essentials Plus, elsewhere it's SOC 2 compliance. These are just basic kind of security. But then you've got lots of ISO standards. It's a bewildering array of letters and numbers like ISO 27001, 82304, etc. 823485, I think it is. So there's just this bewildering array of letters that we need to kind of understand. So there's the technology, the regulation, then the actual kind of coding itself. And these things obviously kind of impact in terms of kind of the cost, but also in terms of the time. The average time, I think, is around, after 2 years, only about 86% of apps are built. So it on average takes between 1 and 2 years to build it. So if you're a clinician with a great idea to try and solve the challenges within the NHS, all of that regulation, all of that hosting, all of that infrastructure, all of that coding, all of that cost is just a barrier that so few manage to kind of traverse. And so any ways that we can remove those barriers means that the technologies are going to be kind of created by the right people. So it is incredibly difficult to and that's why there's so few good quality technologies on the market. So what we see is, I think there's around about 360,000 apps that are on the market, and only about 20% of those reach any sort of baseline criteria for quality, which means that about 80% of apps and technologies out there are at best ineffective and at worst dangerous.
Wow.
And so any ways that we can not only remove those barriers for clinicians, healthcare experts to create those, but also to ensure that they're high quality and effective is absolutely fundamental when we're thinking about innovation.
Yeah. How do you ensure with Cogniss that is the case, in terms of what's the stuff that sits in the background that ensures that rigor and the quality of the applications that you have built?
Yeah, so let me just dive a little bit into Cogniss itself. So Cogniss is a no-code platform for creating digital health applications. That means that anyone, you or I, or anyone with a great idea doesn't need any technical experience or any technical skills to be able to build a technology. Think of it as a point-and-click interface where you can just go into to Cogniss, decide what you want it to look like, the content, the videos, the pathways that you might want to kind of create, and then being able to kind of go in there, design all of that, click save, and have your app created live, instantaneously, in real time. And that's the sort of the power. You can build apps in days and weeks rather than months and years. without a big tech team, without big developers, software agencies, all of those things. So it's incredibly liberating and powerful, for clinicians or healthcare organisations to create these technologies. So that's kind of what Cogniss is. And I've already forgotten the questions.
No, not at all. It was about the background resources that you have that are helping to ensure. You mentioned previously, something like 300,000 apps in the marketplace, only 20% of which are actually in any way, shape or form backed up with real rigor and information that is, quality assured.
Yeah.
How does Cogniss fold that into their process, into their background? That means that is a core part of the premise.
Well, I guess this is the uniqueness of Cogniss itself, because there are other generic no-code platforms out there. I won't mention names, but none of them are specialists in terms of digital health. And so the minute you can create a database and you put data in there, you can't use them in health because they haven't thought about where that patient data lives, whether it's accessible, whether it's secure or not. And so as a clinician or as an organisation, you go to these other no-code and you instantly say, well, I can't do that. And so therefore the choice typically before Cogniss was you either have an expensive software agency build your app, or you don't do it at all. And so we kind of take care of a lot of those things underneath it. So what makes it unique is the fact that all of that hosting, all of that security, a lot of those standards are already in place before you start building. So you know where the data is hosted, you know the security arrangements, you know that it's compliant with Cyber Essentials Plus and all of those other kind of requirements. And that then just frees up that clinician to be able to build that quality technology that's going to have an impact. So that's kind of one of the uniqueness. But because you can do it so quickly, because you get that feedback and you can make those changes in such an iterative process, what you can start to do is involve users and co-design much sooner than ordinarily what you would do. And so that then allows you to start to gain the evidence quicker and faster. So you can actually start to test the effectiveness of your technology much sooner and much earlier than ordinarily you would be able to. And ordinarily in that sort of waterfall approach of app development, you'd get your app, you'd then kind of do some research, you'd then have to kind of analyze that data. But you can continually do that with Cogniss on any app that you build. And what you can interestingly do is actually kind of create multiple versions of that app and test them to find out what the active ingredient of that app is. So you can see what is the effective ingredient of the technology you've built. So all the way from kind of collecting evidence to the infrastructure to the underlying technology, a lot of that is kind of taken care of, which kind of speeds up that whole and accelerates that whole kind of design, build and research kind of process front to back.
Yeah, I love the fact that it enables an agile process because, as you say, the waterfall way of doing things where you get your app and you just, here you go, let's see what happens. It isn't really one that encourages innovation, because one of the things I love about the agile process, as you say, it gets that secret sauce. You get to understand, okay, what's the success thing that's driving this? And then that becomes scalable because you can double down on that because you're able to test so many things concurrently with different users and things like that. What are some of the best ideas or some of the best things that you've seen so far on the platform and with the guys that are using it?
Right. So right now there's over 77 apps that have been built on Cogniss. So everything from information and resources to digital therapeutics to diagnostics and assessments to kind of connecting in devices. It's difficult to say which are the best because often it's the simplest things that are the most impactful. So there's one wonderful app that's in Australia called Raising Healthy Minds, and this is just straightforward information and support for parents of toddlers that tracks with that parent as that child grows up. And so delivering kind of just-in-time information, being able to provide kind of information on developmental milestones, but being able to kind of have searchable content. And that's really helpful because I've got 4 children, and it makes my mind, you never get a manual, so you're always kind of questioning yourself, is this normal?
And presumably
is this right?
each one is different as well.
Absolutely. And so being able to find that information, being able to have that, it's a really kind of simple and straightforward kind of technology, but has a huge impact. And then you've got really much more complex ones, which have decision support, different multiple kind of pathways. And they also have an impact because they're kind of hyper personalized. So it feels like it belongs to you. So based on your inputs, based on kind of what you put into it, it kind of guides you in different journeys through the apps that you might have. So it's difficult to kind of say which is the best, but because there's been so many diverse experiences that we've had.
That's really interesting. Is there something that I know that we touched on? Well, we didn't touch on. I heard at the previous demonstration that you gave about creating the Headspace app in something like 12 hours, which I just wanted to give a sense on the creation process, how quickly you can get from idea concept all the way through to a working prototype or a working app. Is that kind of common, or is that kind of with a bit of guidance, or how quickly does the process usually play out for people?
So it depends on how far advanced you are in your thinking, and we've done even quicker builds than that. So recently, last September, at the World Health Organization's Digital Health Symposium, we were set a challenge. We were set a challenge on how fast could you build an app. And so in the opening keynote session, 2 ideas were pitched to all of the delegates, and they voted on which idea they wanted building. And so we had 2 ideas that we presented. One was for an app for displaced persons, so people, refugees, etc., who might have been displaced, might be experiencing trauma. And then the second one was an app for non-communicable disease in rural areas, so things like hypertension, cardiovascular disease, things like that. And so the audience voted. From my background, I preferred one over the other, but actually the audience voted for the non-communicable diseases app. And then we had some TV screens, and we had an area, and we built them an app live there and then over the course of the 2 days. And if you take sleep into account, we say it took 11 hours, but it probably took more like about 6 hours to build a fully working kind of prototype. Now, with that, you obviously have to have some of the design thinking done in terms of your icons, the look, the feel. You have to kind of use open source material rather than writing your own content. But the actual kind of structural build of the app, can take hours. The thing that obviously kind of takes some time, which is absolutely essential, is that co-design that I mentioned, being able to bring in people with lived experience, bringing in professionals to be able to have that co-design process. That can take a little bit of time, but the actual building of the app is really kind of quick when you don't have to code.
Yeah. And
when you can kind of go back and reiterate and iterate and kind of change that to get the perfect kind of pathway and kind of user experience. So it all depends on the complexity, the size of the app. But as I said before, it changes it down from months and years down to days and weeks.
That's absolutely mad. Anyone that knows software development or app development processes would know that that's an incredibly short amount of time to get to. What are some of the most exciting opportunity spaces that you think this presents with relation to, I'm thinking instantly, leveling up the playing field in places, neglected diseases being one, and things like that. Are there any particularly exciting spaces that you're seeing within the work that's being done with some of the guys that are working on Cogniss and the applications that you're seeing?
Yeah, I think there's so many exciting areas, and you're absolutely right. The one area that kind of really excites me is that underserved populations and communities, those where you might only have a few hundred people. So if you think about rare diseases, I don't know, let's kind of think about lysosomal storage disorders, where diseases like Pompe disease, there might be only a few hundred people, in the country, and yet their treatment can cost, tens, if not hundreds of thousands of pounds a year. So the ability to impact that many lives is really important in terms of cost, burden, and the impact that it can have. But from a commercial entity, no one's going to spend 334,000, $500,000, when there might only be a few hundred people in a country that can benefit from that. And so being able to reach those, you can cross that digital divide. Equally, when there's different communities, different language, different cultures, being able to kind of change and adapt those technologies to meet their needs and meet them where they are is kind of really powerful. As well as actually some of those big hitters, your diabetes, your mental health, but we all treat the same disease in the same way. So if we think about the depression apps out there right now, they treat everyone with depression in exactly the same way. And yet everyone's experience of depression is completely different. And so if we can start to actually have much more hyper-personalized approaches to technology, that we don't treat the disease, we work with the person, this for me is the really exciting thing. The technology is one thing, but actually being able to work with that individual on their specific needs and make that kind of tailored approach, that's kind of really exciting.
And without giving too much of the secret sauce of Cogniss away on that, is there a layer of kind of machine learning that you're folding into the platform and to the apps that are being created that enables that continued hyper-personalization and the work that the guys developing them are putting forward as well?
Well, the secret sauce is there is some AI for event-driven personalization, but that's not your generative AI as yet. We may kind of fold in generative AI, but I think there's an awful lot of work to be done on generative AI. We're still in the early days. We still haven't got the regulations. We're still kind of finding our feet, when it comes to that. But what we do have is the ability to kind of have really complex algorithms to have that personalized journey. So how someone might respond to a particular questionnaire, how people might kind of log into the app or certain things that they might do, being able to then kind of personalize it in that way. Yes, all of those things, that AI for event-driven personalization and lots of really complex algorithms, yes, there is that built into the platform. So you can create those different journeys to meet people where they are.
Yeah, one of the things that you touched on with regards to kind of like rarer diseases, that to pull it back a little bit, made me think around kind of neglected diseases like African sleeping sickness and things like that. With a no-code platform, it occurs to me that this disease, which is obviously going to only spread with climate change and things like that, having the ability for populations who may not have those kind of like embedded coders or people like that, but who want to be able to be boots on the ground, like World Extreme Medicine. So they could have medics going out into the field who are seeing these problems firsthand. The thing that occurs to me is the scale of the opportunity that's in front of them to help with some of those conditions and spread that knowledge.
Absolutely, because if we think about some of those countries that may not have the resources to kind of outsource, either the monetary or the skills to be able to kind of outsource that, are relying right now on off-the-shelf products. And those off-the-shelf products aren't going to meet those local needs. They're not going to be built for that particular local population or that particular disease. And so for me, the exciting thing is not only meeting people in terms of kind of rare diseases, but empowering nations and those organizations to be able to build technologies for themselves. It's a sustainable digital ecosystem, not relying kind of on outside off-the-shelf products, on necessarily kind of Western or other kind of approaches, but being able to build for themselves. To do that at a nation level is kind of really powerful. Being able to set an innovation ecosystem up within a country that fosters homegrown technologies, that's particularly exciting. And we can do that at a nation level. We can also do that at a local level because the NHS is obviously kind of under significant kind of financial burden, capacity issues and things like that. So if we can kind of empower them to kind of create that innovation cycle as well, we can do that at a local level, a regional level or a national level. And so those are the opportunities when you can start to create that innovation ecosystem if you've got the right infrastructure such as no code to be able to kind of create that ecosystem approach.
Yeah, that was one of the things that I was actually thinking in how much impact could be had, in your opinion, with a platform like Cogniss on a national level, as we just spoke about the NHS there. What are some of the impacts that you'd like to see or that you think we could, enable healthcare professionals, clinicians to scale up solutions that might actually meaningfully relieve some of the burdens that are there?
Well, let's look at the numbers. So there's 1.2 million healthcare workers. If we could extend that to care, social care, it's another 1.5. So that's 2.7 million people living and breathing the challenges, but also the opportunities for change as well. And if we could just leverage some of that expertise, 2.7 million people here in the UK, imagine kind of the things that we could do. If we could give them the right conditions, if we can give them the right technologies, the things that you could do is incredibly kind of powerful. And sometimes the impact that you can have is not necessarily big blockbuster things. It's actually some of the micro changes that you might have. So for example, rather than sitting in a waiting room filling out a form on a clipboard and then having to kind of give that back, Imagine being able to just create an app in minutes to be able to kind of do that. And it's those micro changes right across the system that can add up to greater than the sum of its parts. So I think the impact here in terms of technology is really significant. The issue is obviously being able to kind of leverage that, being able to kind of make the right conditions for that, and being, and money in terms of technology is a big factor. We're seeing it with the NHS is unfortunately kind of cutting some of the technology budgets. So even more importantly now, a sustainable approach to technology is really key. So I think the impact and the opportunity is very significant. But there are significant kind of challenges as well.
Yeah, I mean, one of the challenges that occurs to me is, this is where this question comes from, is there a community aspect to the Cogniss platform? And the reason that I ask this is actually you might get people that have seen a problem, many propose a solution for that problem that's quite similar, and actually enabling a kind of a community feel to that might enable them to leverage that shared expertise to solve that problem at a certain scale.
That's absolutely very astute, because that's exactly kind of what we're creating, because we've had situations where an app has been created in Australia and someone in the UK has said, well, do you have an app for example, endometriosis? And there's a technology that's been built elsewhere. So the ability to kind of leverage that community, being able to kind of foster that, what you can do is you can learn from one another, being able to say, right, well, actually, we can use that app, or actually what we could do is we could iterate around it, or we could build from it. So you get this whole kind of community marketplace ecosystem happening where it's a kind of a two-sided. Those that create those technologies, but also those that need it, can kind of come and say, do you have something for this? Yes, wonderful, we can use that. And if not, well, maybe we can build. So you start to kind of get this whole self-fulfilling kind of cycle where absolutely you kind of get the right technologies and that innovation spread. So that's kind of really key. The other thing that we're supporting is building up that ecosystem of partners, those partners that can support people in terms of what they build. So we have different partners that work with Cogniss that help provide content, kind of video. They kind of help provide design, regulatory kind of partners, etc. So being able to remove consistently more and more of those barriers to speed up that innovation cycle.
Yeah.
And then to kind of drive awareness, we work with lots of accelerators and innovation kind of schemes. So, for example, right now we're kind of working with Bite Labs, which kind of helps doctors and medics to understand innovation and commercialization. Being able to give them access to Cogniss over an 8-week period allows them to kind of see what it's like to innovate using no code. So being able to instill Cogniss in each of these different places, being able to build that community, foster an ecosystem approach, again, kind of just removes those barriers and speeds up that kind of innovation cycle.
Yeah, it's that phrase, isn't it? You can go alone quickly, but together you'll go far.
Yeah.
And it's that whole community aspect adds so much to it. I'm guessing that obviously with the regulatory thing, is there advice around kind of legislative nuances between different countries? Obviously you mentioned about bringing something from a app in Australia over to the UK. Presumably there's going to be some different disparities between the countries.
Yes, you'll be. They call things different things, but there's a lot of similarities between them. But being able to satisfy each of them is really important. So there is, for example, when you go over to the US, there's HIPAA and high-tech and other regulations that you need to be aware of. But again, being able to kind of foster that within the Cogniss platform, so we have kind of Cogniss compliance, which allows people to satisfy some of those things, allows people to then internationalize. So you can have your technology, and then you can make it market ready for a global kind of expansion. So that's one of the things in regulation, but equally in things like kind of language. So we have a part of Cogniss called Cogniss Studio, where you can take your app. It's a slimmed down version, and you can just live translate that particular app straight away. So we have one customer that's got apps on, I think, every populated continent around the world.
Wow.
And they send it out to their local office, they translate it, and then they can put that app into the local market and their local customers. So the ability to kind of have that global expansion again is something that's kind of really key, for Cogniss, so that people can go, wherever they need to with their technology.
Yeah, so you're not just able to spin up something for your local geography, you can actually spin up geographically vast regions very, very quickly, translate it all, get it into the hands of users. And also, because you can spin up multiple versions and you can test concurrently, you're going to be able to see and tweak what things will work for one population versus another, and all of these things, which otherwise would have taken research teams from all over the place. You're going to have local boots on the ground talking to specific populations. That's absolutely mind-blowing in terms of how quickly you could scale a product and bring real impact to people. With that being said, I think that this is something that I keep coming back to, is impact. Is what's the overarching vision for yourself with Cogniss in the next time horizon that you have over the next 3-5 years? What would you ultimately like it to achieve? And
what we want to do is kind of establish this as a proven infrastructure for creating digital health at a national level. And so we have national kind of conversations happening right now, but being able to kind of set up the right conditions to be able to innovate on a national and international market. So that's the impact. So being able to kind of work at an individual innovator level, but actually having an infrastructure in place at a national level and international level that allows that whole kind of fostering and collaboration to kind of take place. So you can measure that in millions of lives impacted, you can measure that in number of apps kind of created, but also beyond that, there's other things that you can really do with Cogniss, which is quite interesting. So we have an idea of a super app. And this whole super app model is that you can have one app in the App Store, and then you can have like a library of apps underneath it. Think of it a bit like Netflix for digital health. Mm-hmm. And so you could have a whole library of different kind of apps underneath it, diabetes, hypertension, cardiovascular, etc. And so being able to kind of have this library just allows kind of people to go and pick and choose the apps that they need, or the healthcare professional to kind of prescribe the technologies that they think are going to benefit them. So for us, the impact is that whole kind of super app, that whole kind of Netflix approach to be able to kind of have those technologies so people can find the ones that are meaningful to them.
And that's hyper-personalization, because as you say, you have this library and you're choosing the book. It could be, your subject matter area that you're interested in is sci-fi or cooking, but you get to choose within those, like what particular author that you're going to kind of look after or go for. That creates this personalized experience with regards to your healthcare. And as you say, then you've got potentially clinicians being able to give you guidance on things like that. That's really interesting as a super app concept. I'd never thought about doing anything like that previously, where you'd have this kind of one overarching platform that could then personalize even further within it. What are the opportunities that you see within kind of the clinical spaces as getting Cogniss into, if this is this super app, for example, where are you engaging with clinicians in terms of, is there a want to engage with them and get them prescribing, or not prescribing, it's probably the wrong word, but talking to people about potential apps that they could use if, one thing isn't working for them that they're currently using on the App Store or whatever. Are there conversations that are happening around that expansion? Because one of the concerns that I guess, and I wanted to touch on this with yourself, with technology, is there is a certain amount of resistance within healthcare systems to change occasionally. How can we build those bridges, I think, to see digital tools and technologies as a way to scale human intervention?
And this is one of the big challenges with technology. It's not just about the technology, it's about the adoption, it's the engagement, and it's the spread. The hardest thing is now with something like Cogniss, the hardest thing is not creating the technology. It's actually getting it into the hands of the people that need it and having that acceptance around it. That adoption, engagement and spread is absolutely kind of key. And that's been really difficult in the past because there's a trust issue. Because we've seen some apps that will sell your data. We've seen some apps that don't have any evidence for them. And so a clinician being able to recommend an app is really difficult because they don't know which ones are trustworthy and which ones aren't. And so there are organizations like Orca that help provide that level of trust. But actually, we still have it sometimes if it's not built here or I didn't come up with that idea, then it's not going to be good. And also if they haven't really kind of designed that app, then sometimes they think, well, it's not going to fit for me. It's not going to fit for my pathway. And so one of the things about Cogniss is the ability for clinicians to be involved in that process. If they don't like an app, they change that app. If it doesn't fit for their pathway, create one that does or change one that will. And so the ability to kind of engage, it means that they have the ownership and the trust, because they can see, a healthcare professional over here that might have created it, and so they know where that person is from or where that technology has originated, or they can kind of create it themselves. So that engagement, that trust and that ownership starts to kind of allow the adoption and spread, because you have that magic word, which is trust. And so I think for Cogniss is breaking down some of those barriers as well, by being able to kind of empower those apps to be created.
Yeah, and I think, as you say, ownership and trust are the two vital pieces that are going to move the needle for the outcomes that ultimately patients receive. And this platform is creating that for them, with the benefits of having clinicians able to get involved without needing to know an overabundance of code and spend a vast sum of money on getting that into patients' hands. What are some of the most exciting things areas that you're most excited about going into the next 12 months, 24 months, and things that you would really like to see changing over the short, medium and long-term time horizon with regards to adoption of digital, with regards to the impacts and benefits that patients could get?
Yeah. So the first thing I'm excited about is fostering the right conditions. So we can see these clinical entrepreneur programs, we can see these innovation programs, these accelerators. So being able to engage people early in their kind of innovation cycle is really exciting. Being able to see those ideas come to life. And there's so many wonderful ideas coming through. So that's particularly exciting. And then the whole idea of being able to kind of put, again, those conditions in place that they can bring those to market, and being part of that journey, that journey with them. And then I guess for me, again, the exciting thing is that whole super app idea, that whole library, that whole ecosystem, so that people have the right app at the right time in the right place for them. Being able to kind of create and start to fill that library and start to see these technologies that are starting to address each of these individual problems. That for me is really exciting. And that's why we've got such a broad range, everything from musculoskeletal problems to kind of diabetes to mental health and rare diseases and research apps, women's health technologies. We can see the whole kind of range coming through. So there isn't one particular area of focus, which is, again, really exciting. We're seeing this such a broad array of technologies that we can kind of see the impact, because it's not just in this one particular area where you've got a mushroom or a cluster of apps. You can see it coming right across in the whole spread.
Slightly tangential question. Does it? Do you have kind of integration with APIs for things like wearables and stuff like that? Can you create those within?
Yeah, absolutely. So we're already integrated with things like Apple Health Kit. So we can connect into wearables and devices. We have a Cognis connector, which is a set of APIs. So you can connect in anything that you wish to into those APIs. So whether that's a device that you've specifically built. So we've got some that have built a new device, for example, and need an app to go hand in hand with it. And so, yes, you can kind of do that. And then if you want to kind of connect into clinical systems, yes, you can do that. It takes a little bit of time because clinical systems are slightly more difficult than, say, for example, wearables. But yes, all of those are there. So being able to, again, not just be a standalone, but a truly integrated kind of system, being able to talk with wearables, devices, and your clinical systems, again, that's going to really kind of tie that ecosystem together. And then, being able to have things like, and this is one of the things that we're bringing in, a unique identifier, so that people can kind of share, if they wish to, a patient to share between apps as well. So that actually, if you want your diabetes app to share information with your women's health app, you're able to kind of share that information if you wish to. Because right now, your data between one app isn't really shared with any other apps. And so, again, being able to connect that system together is absolutely key to us.
That's incredible. That genuinely is, because one of the challenges that you have is, as you say, the disconnection of data. But if you can assimilate all of that, you create a full picture of you and your health and how each of the layers stack on top of one another. And also, the other thing that occurred to me then as you were talking, with the integration of wearables and other technologies, you're able to put some more preventative lens on healthcare as well, which folds in a whole raft of new possibilities, as well as I'm thinking and going off on another tangent.
Yeah, the whole prevention is really critical, but it isn't paid as much kind of service in for example, the NHS. Most people kind of jokingly call the National Health Service the National Sick Service, because it's kind of constantly battling to kind of get people well. It's not preventing people from getting sick in the first place. And so and one of the reasons is that again, the kind of the funding, the resources just aren't there to kind of engage in that preventative approach. We're kind of chasing our tail so often in terms of that. And so the idea that if you can create these technologies quickly, cheaply, cost effectively, then actually you can start to have a look at preventative kind of programs. Because the problem with preventative programs is when you're looking for evidence, how do you measure prevention? It's very difficult to say, well, this thing stopped this thing from happening. And so the impact and the evidence and the effectiveness, it's kind of absolutely possible to do, but it's just more difficult to then say, right, well, this person no longer meets diagnostic criteria for anxiety. So that's partly some of the problems that you get with prevention. But all of those things can be solved when you kind of take a no-code approach.
Yeah, I mean, you can gamify experiences, you can pull other levers, you can make it more interactive and playful. I mean, I think about this in terms of the analogy of taking your vitamins or whatever. You take them. I'm in my 30s. You take your vitamins now in the hope that it's going to stave off some stuff later on down the line. Do I feel any different? Not really. But I'm hoping that it's going to be preventative. But I'm just in the habit of doing it. As you say, with that situation, it's a very hard thing to measure. You just hope that it's actually going to stave things off.
There's some interesting ways that Cogniss is already solving this. So in Australia, Sambucol is a cough syrup. You can get that in any supermarket around the world. It's a cough syrup for children. But in Australia, when you pull it off, open the packet and you pull out the bottle, it's got a little QR code attached to the neck of the bottle. And you scan that QR code, and it's an app built on Cogniss that measures the real world effectiveness of that cough syrup. So you can say how effective that cough syrup was for your child in solving some of their tickly cough or kind of chest. And so that, just the ability to kind of collect that information in a real world setting, can be incredibly powerful. It's not your kind of randomized controlled trial, but what it is evidence, and as you get more and more, it becomes really kind of compelling, etc. So there's lots of different ways of being able to gather that. And with Cogniss, there's all gamification built in. So you can have lots of leaderboards and gamifications and nudge and notifications that can really engage. And that's kind of where Cogniss started out, really in terms of behavioral transformation, being able to help people change their behavior in certain ways. And so that's really kind of the driver, because a lot of the apps that are built in terms of health are looking for behavioral change, doing things in a slightly different way, whether that's eating healthy, taking your medication, having different kind of thinking patterns, etc. So being able to have that gamification can be really powerful in terms of the effectiveness of technology. Absolutely.
That's absolutely incredible. As I say, I mean, all of this is making my head swim with ideas around the idea of a super app is something, as I say, never thought of that previously, but I think that in particular is so powerful as a lever in empowering people to make positive decisions. If people want to get more involved with Cogniss and people want to find out more about what it is that you're doing, where would you recommend that they go? Where can they find you?
Well, they can check us out on LinkedIn, or they can email us at hello@cogniss.com. But yes, we're available on most of the media platforms, LinkedIn, etc. So yeah, they can get in contact, and I'd be all too happy to have a conversation with people.
Incredible. Lloyd, this has been absolutely wonderful. Thank you so much for joining and sharing everything with what you're doing, where your journey and where you started and where you're going now. It's an absolutely inspirational conversation.
Well, thank you very much. It's a pleasure.